The actor's family announced that he has frontotemporal dementia, FTD, a type of dementia that most commonly occurs when nerve cells in the frontal and temporal lobes of the brain decrease in number. Mr. Willis, 67, previously suffered from aphasia, which forced him to retire from acting. FTD is a cruel disease that many of us have never heard of and that can affect anyone, the family said in a statement. There are two types of FTD: primary progressive aphasia, which impairs communication, and behavioral variant frontotemporal dementia, which causes personality and behavioral changes. It hits the parts of the brain that make us the most human, said Dr. Bruce Miller, a professor of neurology at the University of California, San Francisco. According to Susan Dickinson, chief executive of the Association for Frontotemporal Degeneration, FTD is the most common cause of dementia in people under the age of 60. She added that roughly 50,000 people in the United States have FTD, though many experts believe that number is a vast undercount due to how difficult it can be to diagnose. There is no single blood test or biomarker to diagnose the condition. Instead, doctors identify it based on symptoms and neuroimaging. According to Ms. Dickinson, it takes patients an average of more than 3 years to receive an accurate diagnosis. What are the first signs of frontotemporal dementia? People with primary progressive aphasia may have difficulty speaking in full sentences or comprehending conversations. They may struggle with writing or reading. According to Dr. Ian Grant, an assistant professor of neurology at Northwestern University Feinberg School of Medicine, those with the behavioral variant of FTD may act out of character. Families will report that patients appear to have lost a little bit of their filter, he says. Someone who is normally quiet and reserved may begin spewing profanities or making loud comments about a stranger's appearance. According to Dr. Miller, the person may appear apathetic and lose motivation. Some people may also lack empathy for those around them. People suffering from FTD frequently struggle with organizational skills, failing to multitask or plan. According to Dr. Joel Salinas, clinical assistant professor of neurology at NYU Langone Health, frontotemporal dementia can also manifest as excessive gambling or impulsive spending. Dr. Grant described the erratic behavior and poor judgment that can accompany FTD personality changes, such as drinking an entire bottle of maple syrup. They may be craving instant gratification with no real ability to control it, he said. Because of these symptoms, patients may be misdiagnosed with a psychiatric condition, such as bipolar disorder, in some cases, according to Dr. Grant. However, there are a few ways to tell the difference between a psychiatric condition and FTD. Frontotemporal dementia typically affects people in their 50s and 60s, and it is unusual, but not impossible, for people to develop a new psychiatric disorder at that age if they have no prior history of mental health concerns, according to him. A brain scan in a person with FTD can also show atrophy or shrinking in the front of the brain, whereas such changes are less likely in a psychiatric illness. What causes frontotemporal dementia? Genetics are a significant risk factor for FTD, but doctors aren't sure what causes the disease in most people, according to Dr. Miller. However, even people with a family history of dementia can do things like exercise, engage with others, and keep up with cognitive activities like reading, crossword puzzles, learning a new language, or playing a musical instrument to reduce their risk of developing dementia or slow the disease's progression, he said. However, there is no evidence that any one activity can prevent FTD. According to Ms. Dickinson, what are the treatment options for FTD? Dr. Grant estimates that patients with FTD will live for 5 to 7 years after the onset of obvious symptoms. But there's a difference between a disease not having a cure and saying, "There's nothing we can do," he said. Patients who have difficulty communicating can benefit from occupational therapy. Speech therapy, according to Dr. Salinas, can also help these patients. Physicians frequently collaborate with the families or loved ones of people suffering from FTD to develop a care plan, which may include safeguards to ensure that they do not harm themselves or their loved ones. Doctors may prescribe medications to help patients manage their symptoms. For example, some patients may be prescribed antidepressants to help them cope with mood or behavioral issues. Dr. Miller said, patients often benefit from consistent, predictable routines, according to Ms. Dickinson. She also mentioned that many patients and family members find solace in support groups. Doctors also work to ensure that families protect themselves. Frequently, the family suffers as much as the patient, Dr. Miller said.